Paul Westcott back here on AM 610 96.7 The Way, bringing the biggest news from New Hampshire to New England and beyond. And this is our first ever Ask the Expert segment. And there's two reasons I do this. First of all, to get an education for you and I. This is a personal thing as well. Learning about some of the important, and in this case we're talking medicine, but learning about some of the importance of orthopedic medicine in this case, but also learning about some of the great businesses we have here in the state of New Hampshire and realizing that, there's so many resources we have here in the state. And joining us right now on the show, we're very excited to have him here, Dr. Eric Benson, MD. Dr. Benson, how you doing?
Very good, thank you.
That is fantastic. And you are an orthopedic surgeon. Tell us a little bit about your group.
So the name of our practice is New Hampshire Orthopaedic Center. We are largely throughout southern New Hampshire, so we're based out of Manchester as well as Nashua. We have 6 offices spanning from Salem, basically as far north as Manchester, and there are 19 physicians in our group.
19 physicians, 6 offices. So you span the whole state. So if people are going to try to find you, they're not going to have to drive all that far.
Exactly. We're trying to be accessible. There are a lot of us, so logistically it would be very difficult for all of us to be in one place anyway.
Sure.
And by spreading out over a 30 to 35 mile span, we think we make ourselves more available.
Definitely. That's great, and that's what's great about it. Now, one of the things I wanted to ask you about that we've gotten quite a few questions through our website on as well is an orthopedic surgeon. I've heard the name. What do you specialize in? Tell us a little bit about your practice.
So myself personally, is my practice specializes in arthritis surgery. So I do primarily hip and knee replacements. And in our group, we have actually 5 or 6 doctors that do that sort of work. That's my own specialty, so it tends to be patients from, say, late 40s right into their 90s.
Okay, so there's a pretty wide age range, and are you usually seeing these patients walking through the door after an accident, or is it increasing pressure over time? I mean, if there's somebody in the listening audience who, say, is feeling pressure or pain in their knees or in their hips, is that a case in which they may want to ask their primary care doctor, hey, should I see Dr. Benson?
Absolutely. I mean, typically what I see, because it's arthritis, is they're not usually acute injuries. They may be the result of an acute injury a long time prior, but they're people that have cumulative wear and tear, and for the most part, they're aware of what they have. It's rare that they come in and they have no idea that they have hip or knee arthritis. There are certainly other areas of orthopedics, like sports medicine, which tends to be younger patients and more acute injuries. Hand surgery, which can be acute and chronic. There's also spine surgery. There's tumors. There's pediatrics. There's foot and ankle. So there's a bunch of different areas that people in our group practice in.
Now, what are one of the causes, would you say, over time? Would you say, as we see America get heavier, that puts greater stress on knees, that puts greater stress on hips and other parts of the body? Is that one of the big causes that you're seeing coming through the door?
It definitely is. I mean, it's kind of a trifecta. 3 things. It's people are bigger and heavier, they're more active, and they're living longer, and they're actually healthier, even though they're in general are Americans over the last 20 years have gotten heavier. So all 3 of those things kind of cumulatively lead to wear and tear. So that if you had 2 patients, one much heavier than the other with the same looking X-ray, with regard to knee or hip arthritis, the heavier patient inevitably would have more symptoms from it and might pursue surgical treatment earlier.
So that's got to be one of the things, that another reason to lose weight, another reason people are looking at this saying, I don't want to have to end up seeing you. But if they do end up seeing you, what sort of treatment would you be giving them, and how would the process go from being referred from their primary care doctor to you? How does that process work?
It used to be, say, 15 to 20 years ago, that primary care doctors would need to refer a patient for a patient to be seen by a specialist. The reality now is that more than 80% of the people that walk through the door don't actually need to be referred directly by their primary care. So a lot of times they are, or another common scenario is someone starts having symptoms, talks to a friend that had a similar thing, and ends up, going to see in a lot of times the orthopedic provider that the friend saw. So. The symptoms, typically somebody would come in as far as treatment options. First visit would concentrate on diagnosis, so, physical exam, a good history of what the symptoms are, and then x-rays that can be done right on the spot. If other imaging needs to be done, that's something that we would arrange for and take care of sort of all in-house, whether it's an MRI or whatever it might be. So after the diagnosis part, typically if it's arthritis, we're going to try some kind of non-surgical treatment. We're always going to start with the least invasive option. It could be an anti-inflammatory. It could be an injectable material for the knee, and there's actually quite a few options now for that, or it could theoretically be a brace or even physical therapy.
That's great, and that's one of the benefits of being as big as you guys are with the New Hampshire Orthopaedic Center is you still have the personal touch, but at the same time you also have the resources to be able to take care of this on site, take care of the X-rays, take care of other scans, and looking into these parts of the body without having to go to an outside doctor. Would you say that's one of the big benefits?
It's a huge benefit, and it's something that we find our patients really looking for is the ability to. If they have to spend time at an orthopedic appointment, if they need other things done, if they need an MRI, they need to be referred to PT, they need a brace. They want to do it kind of one-stop shopping. They want to come to the facility that they're gonna go to and be able to do as much of that as they can in one place. And we've really tried to make an effort to provide that sort of thing at multiple locations.
We had a question, by the way. Alan from Hooksett wrote in asking us, saying, "I've got pain in my knees right now. Does this mean I should be seeing an orthopedic doctor?"
It kind of depends on. That's a great question. It really depends on how it's impacting on the patient. So if it's something that he has every day that affects things that he or she wants to do, we would definitely recommend an evaluation to look into it.
All right. That seems to be the ongoing trend here. People feel this pain. They feel some pressure. And I know I have, looking at some of the people who I know in my neighborhood who asked me about this, said, I've got this pain. It's every time I sit down or it's every time I perform a certain motion that all of a sudden they feel this stress. Or I go to my kids' play and all of a sudden my knees they just start feeling sore, right? Half of it's leaning up against the seat and half of it might be something else. Is that typically what you see as well?
Very frequently, yeah. Where people will come in, they won't just come in randomly. They'll come in if there's some specific thing that they want to do or that they do regularly is affected by it, whether it's someone that commutes in a car that says, my knee hurts when I'm in the car more than 45 minutes, or et cetera. And a lot of times just by getting a good history from the patient, we're able to kind of narrow it down to probably one of maybe 3 or 4 things that might be causing it before getting onto the treatment phase.
This is fascinating stuff because I think it's something that it's not a form of medicine that's getting smaller. Certainly, I have to imagine the number of patients coming to you are just growing by the day.
They are, and I think again the fact that people are living longer and living healthier longer and staying active longer
Sure.
are all part of the reason for this. And I tell people whoever invented people didn't expect us to live for 100 years. And just like with cars, things wear out after 60,000 miles, and sometimes you need to come in and get your timing belt redone.
Exactly, and it doesn't. Don't use it as you're not breaking down. It's just what happens with age. Correct.
Absolutely, and the thing is, we have a lot more in terms of technology now to offer people. So, 50 years ago, if you were 50 and had arthritis in your hip, you took a walking stick, and that was the end of you. And, now there's a lot more. There's a lot more available, and people and more are aware of that, based on the internet as well as other means.
Well, you don't have to live with the pain, I think, is the end result of this message. You don't have to live with it. Dr. Eric Benson from the New Hampshire Orthopaedic Center, part of our Ask the Expert series. We appreciate you coming on the show.
Well, thanks very much, Paul, and enjoyed being here, and I'll be looking forward to coming back on.
Definitely. And you could hear a full podcast on our Ask the Expert page of this interview. If you want to learn more about New Hampshire Orthopaedic or any more about Dr. Benson, go to WGIRAM.com or 967thewave.com. It's right there, right on the homepage, and find out more. All right, folks, we'll be back. Mark Hebert coming up here on AM 610, 96.7 The Wave.